Welcome back to Insightof channel. If you follow our previous episode, you already know how crucial it is to navigate regulation the right way in Indonesia. Today we are diving to the world of medical devices, not just those used in hospital, but also tools found in clinic, at home, or even wellness center. We are talking about thermometer, surgical gloves, even heart stand. If it helps diagnose, treat, or support human health, it's regulated. So how do you get your device registered and approved in Indonesia? Let's go step by step. Medical device registration is more than a legal step. It's your ticket to Indonesia's full healthcare market. It allows your product to sell in not only in the hospital or clinic, but also in modern retailers, store, online store, and even government procurement program. Getting registered doesn't just make you compliant, it makes you visible and credible. And for foreign brand, it's the key to entering one of the region's fastest growing market. Indonesia is Southeast Asia's most populous nation with over 2,284 million people and a public health insurance coverage of over 258 million. Thanks to BPJS Kesehatan ya. In 2023, Indonesia's medical device market reached approximately 4.58 billion US dollar, and it's projected to grow at a 9% compound annual growth rate through 2033. The sector is expanding fast, driven by growing demand from both public and private hospitals, urban healthcare infrastructure, and wider health coverage. This growth isn't just in high-end hospital equipment. Over 70% of medical devices in Indonesia are imported, but the government is also encouraging the local producers with incentive and local containment. So whether you are offering diagnostic kits, home use monitoring tools, or lab devices, you are entering a market that's big, growing fast, and open to innovation. And when your device is approved by the Ministry of Health, it receives an official license. It receives an official license code. And here's where it matters. There are two types, which is AKD, Alat Kesehatan Dalam Negeri, for medical devices manufactured in Indonesia, even if by a foreign-owned company. And the second is AKL, Alat Kesehatan Luar Negeri, for devices manufactured abroad and import to Indonesia. These codes are mandatory on your packaging official document. And here's the catch. Foreign manufacturers cannot apply on their own. You'll need an Indonesian legal entity like a distributor or license holder to submit on your behalf. So make sure you are a partner with local entity before planning your launch. Now let's talk about the device type. There is a required step before starting your registration. First, electromagnetic radiation medical device like X-ray machine, radiotherapy tools that emit radiation. The second is electromagnetic non-radiation that doesn't emit, such as ECG or ultrasound device. The third is non-electromagnetic sterile. Non-electric tools that require sterility like surgical tool or implant. The fourth is non-electromagnetic non-sterile that don't need electricity or sterility. And lastly, diagnostic in vitro. Device that analyze sample outside the human body like blood test or lab diagnostic. Selecting the right type sets the direction for your documentation and timeline. After categorizing your devices, the next step is identifying its risk class. This part isn't about how complicated your device, it is about how much potential harm it could cause if something goes wrong. Risk classification exists to protect the people who will use or depend on your product. It seems from perspective of patient or user safety. The higher the risk, the more detailed your documentation must be. First A class is low risk. These are simple, non-invasive items like surgical gloves or thermometer. And then the second B class is low to moderate risk. The device is like blood pressure monitor or sterilizers. And the third is 2C class. It is a moderate to high risk. The device is like infusion pump, imaging tools, anything that could directly affect health if used incorrectly. And the last is 3D class. It is a high risk class. Life-sustaining product like pacemaker and heart stand. These require complete clinical, technical, and safety validation. So remember, this isn't about making things difficult. It's about ensuring that every device used in Indonesia is safe, effective, and reliable. And it all starts with proper risk classification. Now let's talk about the document. This is the part that causes the most delays, but it's also where we help the most. You'll need a mix of legal documents, technical files, certificates, and product labeling. Almost every device requires authorization letter from the manufacturer and a certificate of resale and ISO 13485 and a detailed product summary. Then there's your declaration of conformity, risk evaluation, post-market surveillance plan, and label designs in Bahasa Indonesia. And yes, every word must be translated and meet ministry font size and content rules. If any of these are outdated or incomplete, your application won't even reach the review stage. So be thorough, accurate, and organized. That's what shortens your approval time. Let's run through the 5 common reasons why device application fail in Indonesia. The first is wrong risk class. Choosing the wrong class sends your file to the wrong reviewer. Expired certificate, ISO or CE expired last year, it must be rejected. And then label mismatch. If your product label says sterile, but your document says otherwise. And the third is no local entity. You must apply through a registered Indonesian company. And the fourth is no post-market plan. If you cannot show your handle complaint or recall, you won't get your approval. These are common pitfalls, but with the right team, they're easy to avoid. And when you work with Insightof, you're not just hiring a form filler, but you're getting a dedicated team that's seen every type of registration challenge and solve it. We review your product, classify it properly, and tell you exactly what you need and what you don't. And then we prepare the document, translate them, and upload everything to the ministry system, formatted perfectly. And when the ministry asks for clarification, we handle it fast. From kick-off to final license, we stay with you actively managing the process. No confusion, no delay. Indonesia's medical device registration is detailed but manageable, especially with the right partner. Whether you are a startup brand or a global manufacturer, we are help you launch faster, safer, and smarter. Don't forget to like and comment with your question and subscribe for more practical guide. I am Filia and this is Insightof, where compliance turns into confidence.